UnitedIntentions.org. Catch us on Facebook and Instagram at United Intentions and Twitter at Higher Intention. Look for us on 99.1 FM, iTunes, iHeartRadio, Spreaker, Stitcher, Blog Talk Radio, and many more. Over the next hour, we'll introduce you to some fascinating people and engaging discussions that may provide you with answers to assist in revolutionizing your own personal health. And now, here's Dr. Nelson.
Hello and welcome. You're listening to WDJY FM 99.1. This is Health Matters, and I'm Dr. Nelson Bulmash. Thank you for joining our show. If you missed the last episode, I interviewed world-renowned medical doctor, researcher, and psychiatrist, Dr. Steve Halterwanger. He delved into the importance of getting back to the basics of minerals and mineral transport. So if you're anyone who's suffering from health problems or you're not performing at the level that you want, please find his interview archived at UnitedIntentions.com, YouTube, and Spreaker.com. We have an amazing guest today, a very good friend of mine. I can officially say that I have known her for over half of her life. She's amazing. Ladies and gentlemen, please welcome Dr. Grace Stephen.
Thank you, Dr. Bulmash, for having me here.
You're welcome. It's a pleasure to have you here. So I'm going to change the rules a little bit here. Originally, I told you we were going to speak on yoga and women's health, and we're mostly going to do that.
Okay.
But as current events change things, we're going to change up a little bit too, and I hope you'll indulge me, okay?
Sure, absolutely.
So you're an amazing person. I feel so honored, and I'm sure the guests will feel equally honored when they hear you speak. You and I have known each other a long time. We met working on our doctorates together at Life University many years ago.
Yes.
I'm not going to say how many because nobody
Good.
would believe me. They would think you entered the program at 10, and I entered it at the normal appropriate age for somebody working on a doctorate at that point in their life. But what I want to do is I want to get them caught up on who you are. Grace, I'm always fascinated by what gets a person to where they are currently in life. And you have an amazing story. Share it with us, please.
Sure. So I am what's called a professional yoga therapist. I also teach Qigong, meditation, and Tai Chi. So there are mind-body practices that I think are beneficial for everyone. But initially, I got into yoga as cross-training. I was involved with many different types of sports, and I felt like yoga helped me stay flexible, reduce my risk of injury.
Right.
Just kept my mind calm, helped me with breathing before a race or an event. But in 2008, everything changed for me, including even the type of yoga that I practiced. I was in a very severe car accident.
Right.
And the new body that I had after the accident was not the body that can continue the type of yoga that I was doing at the time. Many parts of my body. The most severe thing was my spine and the ability to walk again, to have a quality of life.
Right.
My rib cage was torqued. I had trouble breathing, which in turn created a lot of anxiety because if your breath isn't right, you will definitely not breathe properly.
That's right, sure.
So emotionally, spiritually, it was very difficult because I was mourning the life that I had before. Very involved in sports and probably did 2 to 3 trail runs a month and would travel for them. So that was a big part of my life. And, I was talking to a neighbor of mine who's a pastor, and at the same time he had spinal surgery. And we were talking about, it's very easy to feel spiritual. It's very easy to feel grounded. I'm not so sure it's that easy, but, it's more, it's less intense to feel grounded and emotionally well when your body is working.
Yeah.
When
life's easier.
Yeah,
Let's face it.
Life's easier. Your
when things work,
spirituality
they
is
don't
easier.
tax you. They don't test you much.
Right.
Yeah, I get it.
And so even, the spiritual side of my life was taking a toll because I was in pain every day.
Yeah. Hard to be happy and pretend that life is all fairy tales.
Exactly.
When you're hurting a lot. Sure.
And so one of the things that I did is I really started to practice what I've learned over the years in yoga. And that was, self-awareness. How am I feeling? And what am I telling myself about how I'm feeling? And how is this translating to quality or health in my life? And when I did that, things started to change. And I remember reading an article where they were interviewing Oprah, and she said, I was at this point in my life where I needed to make decisions about my career and my life. And the number one question she asked herself was, how can I serve? And I thought, that's a wonderful way to live, to take all the feeling like a victim,
right,
because my life was changed, and going from a place of feeling like a victim to being empowered. That was the first step in my yoga journey. And so I was very fortunate to be introduced to a woman in Cartersville who changed my life. She was a yoga therapist, and she taught me that there's many different practices of yoga. There's different ways to do things you can modify. And slowly but surely, being compassionate with my body and being able to modify many of the poses, I started to get stronger.
Right.
I started breathing better. I started feeling better. I actually started having a quality of life. And the first thing she said to me when I came to her studio was, honor the body that you bring to the mat, whatever
Wow.
it is,
That
without
is so
judgment.
beautiful,
There's
right?
no room for judgment on the mat. And when you honor that, know that tomorrow may be different. Every time you bring your body to the mat, your mind might be in a different place. You might feel a little achy. And you get out of the judgment, well, what happened? I balanced yesterday. Why can't I do a balancing pose
Sure.
today? And I think just having that support, physically, emotionally, spiritually, everything started to change for me. And then it was very clear. I knew how I can serve. Meet people, talk to people, show people who are going through trauma in their life, experience physical trauma or emotional trauma, and be able to stand or sit side by side with them and say, yeah, I understand. We're all human. We all have these. Your pain might be different. Your injury might be different. But there's a place where you can begin.
Beautiful. So you could suddenly relate to the suffering of others maybe in a way that you hadn't been able to before.
Absolutely.
Fantastic. And so you used yoga as a vehicle, even though you were a very serious inline skater, CrossFit athlete, and so forth. So it gave you a place of entry to sort of to regroup and to refine yourself, to develop a context for purpose again. And you said you got into teaching. How exactly did that happen?
That was, I guess there's no accidents, but it was
Right.
sort of by accident. So the woman who I was mentioning earlier, she has her own yoga studio for many years, and she said, hey, I think I need to go out of town, and would you cover the classes for me? You've been through the teacher training, and I think you're ready. I didn't think I was ready at the time. I actually panicked a little bit, but after that first class, I realized that's how I needed to serve. That being a teacher of any sort is such an enormous privilege. And to be able to talk people through movement in their body, to talk them into, hey, you can breathe better, and see things in them and see or give them hope, see things for them they can't see yet for
Right.
themselves,
Beautiful.
was such a privilege. That started me on the teacher
Isn't it
path.
funny? Sometimes, Grace, you just have to jump into the cold, dark water and realize,
Yes.
wow, I can swim.
Yeah.
Yeah.
Yeah, and be
Fantastic.
accepting. And not just yoga is not just about being physically flexible. It's also mentally flexible and emotionally, and being able to navigate life wherever you're at and say, wow, look at where I've been, but look at what's happening now.
Right.
And all teachers, my hat's off to them. It's a calling.
Yeah,
And it's
no question about
definitely-
it. And sometimes it has to be revealed in strange ways.
Yeah,
apparently.
it's very strange ways.
So, you brought up something that I'm very pleased with, because one of the things I noticed today, Grace, is that when you see a lot of people doing yoga, one of the things that I notice, and don't misunderstand, I think it's extraordinarily beautiful to watch a woman or a man doing a very, very difficult asana or pose. But you and I have spoken about this before, and yoga is way more than just the asana, way more than just the pose. Talk to us about the other aspects of what yoga is, because it's so much more than just learning how to hold a particular pose.
Exactly. Yeah. I'm glad you brought that up, because many people think I'm not flexible enough, or they think they have to be flexible or even lose weight to go to yoga.
Yeah, very
Right.
true. Me included. After breaking my back, I thought, yoga? Are you kidding me? Come
Yeah.
on. I'm made of bamboo.
I understand. But the beautiful thing about yoga, there's actually 8 limbs of yoga. And there's a few that we're going to talk about today, but one of those things I'd like to talk about is that you have to, it brings self-awareness. And when you're self-aware, you say, well, you know what, maybe the yoga postures are not what I need at this moment. Maybe it's the ability to focus on one thing instead of letting my mind go in 10 different directions.
Right.
Maybe it's the ability to go inside and understand, why am I thinking what I'm thinking? How am I doing with how I'm feeling? How am I processing my emotions? Sometimes it's best for a particular person where they are in life to get into one of those limbs first instead of the asana. Originally, asana, or the postures, were something that monks did thousands
right.
of years ago to be able to sit in meditation. So that movement, the flowing of the body, getting the muscles warmed up, getting the joints warmed up, allowed them the ability to sit and meditate for many periods of time. So when people think yoga, many times they do think of asana or postures or, going to a yoga studio, but there's other paths that
Let's take a moment to talk about that. I love that you and I have spoken many times on the importance of not only the physical expression, but of the mindfulness nature of yoga. And I think that one of the things that may be missing today is that we're so distracted constantly by what catastrophic event has happened, whether it be a hurricane, a fire, a flood, who's killed who in the world, what's going on in the political realm, that we're kept in this sort of state of suffering. Constant distraction and suffering. And what I love about yoga is it brings this notion forth of mindfulness. And I know you and I spoke originally, and I apologize in advance. I'm going to take Dr. Grace Stephen on a side note, a sidebar for just a second, because you brought something to mind that I think is really important in light of today's current affairs. We all know that something very catastrophic, very tragic happened down in Florida about a week ago, and a young man became very misguided, and he killed 17 of his peers. So one of the things that I want to talk to you about is I certainly don't have an answer, and nobody has a single answer. And I'm not interested in getting in a tug of war between those who think we should or shouldn't have access to guns. I want to suggest something else. I think ultimately it goes down to training. And one of the things I want to explore with you, in addition to talking about women's health issues, Dr. Grace, is what might happen if we started teaching children at a very young age, and I'm talking about kindergarten, first grade, the elements, if you will, of yoga, and what you think. How would that begin to affect the quality of our lives? Could you talk about that for a moment? Yeah,
I'd love to, absolutely, because I have Police Athletic League. I want to talk about Police Athletic League of Marietta. They are doing such great things for children, and one of the things that they invited me to do, it'll be 3 years now, is to work with children, elementary school age, junior high school, and what we're doing is not just the asanas again. It's about teaching these kids, for your feelings, emotions, all of that, you want to acknowledge. Right. You want to acknowledge. You don't want to act like it's not there. And so lots of things come up. These kids going through puberty. And,
hormonal changes.
All kinds of hormonal changes. A lot going on in those classes. And what we do is we talk about, okay, let's take a moment. Let's breathe. Let's talk about, discuss what you're feeling. Where are you feeling it in your body? Right. Sometimes people feel things in their head and their stomach, and and what can we do about it? Yeah. So I think it's really important that even adults, and it might be some of the parents, and, unless you're taught skills to deal with stress, to deal with life, because life's always going to happen. It's how we respond to it. Yeah, I think at an early age to have children learn, okay, this is what I'm feeling. What can I do to change it? How can I use my breathing, my thinking, my movement to shift into a more healthier headspace? Yeah, I just happen to notice, I've been meditating for many years, and one of the things I noticed years ago, I was out with a friend of mine who's also an avid meditator, and he said, "Are you ready to go out and get in a bar fight?" And I said, "Yeah, no, not so much." And he was being playful, of course. He was another doctor, a friend of mine. And the point is, we were so mellow, we were so stable, and so
balanced emotionally, that the last thing in the world, and this is part of my point, is the last thing in the world we were interested in was going out and conducting acts of violence against particularly innocent people. You know, so I'm just wondering, and listen, Dr. Grace, I'm putting this out to you, but I'm also putting this out to all your peers. If there's somebody who's listening, I would be interested in actually doing a show and having you host this with me. If there are teachers out there teaching yoga who specifically could take this opportunity to teach young kids, maybe beginning in elementary school, if there are programs teaching people like our vets, firemen, police officers, I would have to imagine, and I'm sure somewhere somebody has statistics on this, and I would love feedback from somebody who has the answer to this question that I'm going to pose. I'd like to know how it alters things like stress levels, PTSD, criminal activity.
Sure, yeah.
You and I both know, we've read articles that in areas where people do yoga, in areas where you reach a critical threshold of people meditating, the crime literally goes down. And I think, Dr. Grace, you were the one who told me that they were using yoga therapy at certain prisons. Am I correct?
Yeah. They're using yoga therapy in prisons, meditation,
Right.
Again, not just the asana or postures. They even have yoga in some schools, and I would love to see it in all the schools. Just giving, not just for the students, but for the teachers, learning how to deal with the stress level. It makes a better environment for everyone. There's classes that yoga teachers, so once you go through yoga teacher training, you have options. You can really specialize in something, and there's amazing yoga instructors out there working with people with PTSD, working with our vets.
Right.
And I think that's fabulous, and that's kind of, like I said, that's how you serve. You know?
I agree. You know, it's heartbreaking. I received some information several months ago that indicated that almost 40% of the homeless people are former vets. That's tragic to me.
It is tragic.
I have absolutely no understanding as to how we can allow that to happen in our society. I mean, so here's another way that perhaps we could help some of these people who are battle hardened, who are having difficulty transitioning back into the world, with a way to calm and refocus themselves, so that that transition is easier.
Absolutely, and you know that again is part of the limbs. You know, how to go within,
right,
to be able to live and breathe and work better in our communities.
Sure.
One of the limbs of yoga is considered the yamas, and there is a yama called Ahimsa, which means nonviolence. And that's one of the principles of yoga. It's just non-violence as to don't go into a school and shoot up other children.
Right.
It starts with you, right?
Sure.
Your thoughts. I mean, sometimes we're our own worst enemy. People will say horrible things to themselves that they wouldn't say to a stranger.
Yeah.
And so practicing Ahimsa personally, that non-violence, will spill over into everyday life. You know, if your coworker who is unhappy and they're practicing Ahimsa, nonviolence, and
yes,
it's going to affect how your workday goes.
Well, it's certainly a whole lot easier and more fun to be around people who are happy.
Absolutely.
Yeah, and you know, it's interesting. You brought up another point of concern and consideration, which is, I think if you learn to take great care of yourself, and to like yourself, and to learn to deal with your emotions effectively. Because, you know, we make it often wrong in our society to talk about being angry or being frustrated or being depressed. And we're kidding ourselves collectively as a culture if we don't address that at one time or another, we all feel those feelings.
Absolutely.
I mean, there are times that we're in outrage. When I hear about these tragic shootings, I'm speechless. I'm in absolute outrage. And the thoughts that go through my mind are certainly not always unconditional and immediately forgiving. And I'm sure that it's got to be nearly impossible for the parents and the loved ones who go through the tragedy with those who are lost through such horrible things as what happened in Las Vegas and in Florida recently.
You know, and it's unfortunate, but, you know, the life we lead includes suffering.
Yeah.
And
you need that contrast, don't you?
Yes. You know, there's suffering, and there has been, there always will be. And maybe it's yoga for someone. For me it is, as well as Qigong practices, learning how to navigate through suffering and being a kinder person for it instead of bringing more anger
right
to the planet.
Yeah, I think I think right. If we all have less suffering, it's easier. It's hard when you get to that point where you're just stuck. I know when I broke my back, I went through years of rage. I felt like I could hardly function in society, and I refused, by the way, to own a firearm because I was so hopeless at various times in my life after I broke my back that I wasn't sure that I trusted myself to have a firearm.
Yeah.
So I did not own one. Now I enjoy shooting, so I do shoot, but I am very careful, by the way, that I never shoot when I'm angry.
Yeah,
You know?
exactly.
I mean,
Yeah.
you have to be so careful about what you do when you do what you do. So let's talk some more about the other elements. That's fascinating to me. So we talked about the postures. We talked the postures. Excuse me. We talked about meditation. Tell us about some of the other elements that inform us about the complexity of yoga and how it helps us to alter our lives physically, emotionally, and spiritually.
Sure. Well, there's different types of meditation. It's actually broken down in the 8 limbs. And so one of the first practices you would do before meditation, because that's what I always hear. I can't meditate. I can't stop my mind.
Sure.
Most people are just too busy, too stressed, have too much anxiety to say, I just can't stop my mind. So there are practices that you can do one-pointed focus, right? So that means, let me just give you an example. So you want to learn how to quiet your mind, but you can't get silent and just sit there. The thoughts keep going. So
Right.
maybe you focus on one thing. This has been done for centuries in all different types of religion. Take Catholicism. You have the rosary beads.
Okay.
And you recite the prayer. And there's mala beads in Buddhism. And Hinduism. Right. So
Right.
that's one-pointed focus. You're using something. Maybe and mantra just means a phrase. So maybe you're using words. Maybe you're using mantra in the phrase, making it really simple.
Right.
I'm grounded. I'm lifted. I'm balanced. Something like that, where you say a mantra and maybe use the beads, maybe you don't, maybe you touch your fingers.
Sure.
One-pointed focus. Maybe you look through a candle flame and just focus on the middle of the flame, just teaching your mind how to have that one-pointed focus. So it's more of an external approach. And once you practice that and practice it, and again, it's called a practice. It's not called yoga perfect.
Perfect,
It's
right.
called yoga practice.
Good point.
Once you practice different things like that. So maybe one day it is for you for beads. Maybe it is candling. Maybe it's staring at a dot or a picture on a wall.
Sure.
And learning that one point of focus. From there, you can go more internal, which would be the next step in a deeper step in the 8-path fold, where you're going internal and you're understanding, listening, or feeling the environment inside of you, what's
Right.
going on, so that outwardly you can create a better environment for other people.
How wonderful that it starts out so simply, meaning that you can focus on the flicker of a flame
Yes,
to bring your attention to a single point of focus,
exactly.
making it more tangible, certainly easier. You see the flame, or you have a bead, if you will, that you move with the action of a thumb or a finger, that helps you in turn develop strength in the ability to then focus on something that's less tangible, which is the notion of focusing within.
Yeah, and basically when you're starting to calm the mind and you're shutting things down a little bit and just getting that little break in the thinking, really that's meditation. Your brain is built to work. It's built to think.
Sure.
That's what we do. And it's not that you're shutting off all your thoughts. It's the meditation and the breath, prana, that life force comes in between those points of where your thoughts have a bigger gap. So you're breathing into that space
Right.
of your thoughts. You're healing into, because healing occurs in expansion.
Yes.
And so
Good
you
point.
have to have some expansion between the thoughts to allow that healing in. Because I always say, prayer is a time, maybe you're asking, oh, please God, heal me. I want my back to be better. I really don't want to have this back surgery. I did all that.
Right.
And not that God didn't hear my prayer, but when I meditated, I heard the answers. So prayer is a time to talk. Meditation's the time to listen.
Fantastic.
And I think
What
that
a
if we
great
listen
point.
more,
Yeah.
if we listen more internally and externally, we can live a happier life.
Yeah, you and I have joked about this before. And I'm laughing because you know where I'm going with this. I wonder sometimes if God is, and I'm being playful when I say this, sitting up there going, Nelson, for heaven's sakes, just be quiet and listen. Enough already.
Exactly.
Close the mouth and open the ears. All right, let's get back. Thank you for allowing me to take you on that segue. Let's get back and discuss more the issues that many women have in today's society. What are some of the big health challenges, whether it be emotionally, physically, or spiritually? I know we have the big Me Too movement, and we don't necessarily have to get in that, but talk to me about some of the issues that women present to you and how you handle it from a yoga approach.
Yeah, there's, because I see so many different age groups, right? So I'm seeing the young women who are starting their menstrual periods, and maybe they're having cramps or experiencing migraines with it. One of the beautiful things about yoga is that wherever you're at, I guarantee you there's an answer for your yoga.
And
so
somebody else has been there.
Right. So there's postures. There's something called reclined Baddha, which is excellent for anything from menstrual cramps to menopause, migraine headaches. It's a wonderful, wonderful posture. So there's so many different postures you can do to help with these different issues, whether it's, like I said, menses to menopause, anything in between.
Forgive me.
There's also not just the postures. There's something called Ayurveda. Some people are familiar with it. It's similar to traditional Chinese medicine. And an Ayurvedic specialist can help you ease the pain or suffering from hormonal issues or stress. They look at different types of constitutions, and they look at the it's a holistic point of view. Like, we're looking at how you're eating, when you're going to sleep, what are your practices. There's wonderful practices where you can self-massage with specific oils for your constitution. There's tongue scraping. There's dry brushing to improve circulation and lymph flow. There's a lot of self-care.
So all things to bring balance back.
Yes, everything's being balanced. So the breath and the mind and having that Ayurvedic specialist on your side to help and guide you through different periods of your life. There's an excellent resource. It's called NAMA. So it's Ayurveda NAMA, NAMA.org. It's the National Ayurvedic Medical Association, and they're the only state certified program. So these Ayurvedic specialists receive clinical training, and my Ayurvedic specialist, she said something, and I absolutely love this. It's so true. She said, yoga, Ayurveda, the whole practice, all the principles all together really help you bring self-awareness, and through self-awareness you will have better self-regulation and then self-mastery, right?
Perfect.
So, self-mastery is taking care of yourself, listening to yourself. Many women feel they don't have time to take care of themselves because they're taking care of a household or they're taking care of their children. So there lies a lot of stress, and a lot of health issues go by the wayside because they're so busy taking care of everyone else.
Right.
So there's a quote by Ganga White that I love, and I just heard it recently, and Ganga said, yoga doesn't take time, it gives time.
I love that. That's so beautiful.
And I think when women start to realize that taking time for themselves will improve every part of their life, spiritually, sexually, mentally, physically, they'll realize they do have more time in life to enjoy things. It's a fuller life.
Yeah, beautiful. Makes a lot of sense. So you spoke about young women. What about people in their 30s and 40s? What kind of issues do those women specifically bring? I know you mentioned taking care of a household. In many cases, that's certainly true. Are there other issues that you hear about more frequently?
Well, I think, as you know, we're all aging. We're all dealing with this thing called aging.
Yes.
And what ends up happening is, I'll see the 30-year-olds that will say, wow, I used to do this. I used to be able to run so far in my 20s, and now I can't. And then,
hard to hear that, right?
Yeah. Then I hear women are like, wow, I turned 40 and everything fell apart. And, just it continues with the 50-year-olds. But that's the gift of yoga. It's sitting back and it's saying, wow, let me breathe. And what's going on with my body before it falls apart? There's a book called The Myth of Aging. And they talk about, unless you have rheumatoid arthritis or some type of, autoimmune disorder, mainly our aches and pains are coming from not moving our muscles. This is our support system for the whole skeletal system. If your quadricep is tight, if your hamstring's tight, you're going to have knee pain, you're going to have back pain.
Right.
So, just discussing with women, yeah, I hear you, we're all going through this, but here's some movement. Here's some gentle movement. I just came back from Thailand, and sometimes people haven't been moving for so long. They have kinesiophobia. They're scared to move.
That makes sense. It's foreign.
Yeah, and another avenue that I found that helps people start moving again gently and safely, where they begin to trust their bodies, is Thai yoga massage. It's taking people through movements very safely, and moving them in different postures that resemble all the yoga postures. Thai yoga massage has its roots in yoga. So that's another way if someone feels that, they're injured, or they're just, I'm 40 years old now, I'm not feeling like I used to, and I'm scared to go into a group class.
Right.
Just getting a Thai yoga massage.
Makes all the sense.
Yeah, it does.
So in other words, yoga meets you wherever you are.
Absolutely. Couldn't have said that better myself.
Fantastic. Grace, thank you so much. We're going to take a quick break. Here's a word from our sponsors. Ladies and gentlemen, you're listening to Health Matters. Our guest is Dr. Grace Stephen.
Hi, my name is Maria Sullivan, and welcome to The Silver Lining, a show about overcoming anything life throws at you and seeing the blessings from within. I've dealt with people from all walks of life, people who have believed there was no way out or have given up on life. Well, I'm here to tell you that there is light at the end of the tunnel.
30 more minutes.
There is always a silver lining if you know where, how
how
to look for it. Join me on the United Intentions Network and on Spreaker at United Intentions as we discuss the unfortunate situations in life and learn how others have found their power from
All right,
within.
so 10
Hear how
seconds.
they've
All right, so I'm gonna go
transformed their
into your
world
day.
and the world around them for the better. I invite you to listen in, and I hope to see you there.
Welcome back. You're listening to Health Matters. My guest, Dr. Grace Stephen. So let's take a look at this. We've spoken a lot about yoga and how it has different elements that meet us wherever we are in life. Let's look at, what does your day look like when you begin a day?
Well, it's funny that you said I haven't looked like I've aged, but
You don't.
I have aged, and I am aging, and I'm at that 40 plus, well, maybe a little bit older than that. I won't say on air.
We won't believe you, but go ahead.
Again, yoga meets you where you are, and it's more about awareness than anything. And so my yoga practice starts when I wake up in the morning. Basically, it's me just checking in. How am I feeling? How's my breath? Am I breathing properly? Am I on my chest? In my belly? Did I good night's sleep? What's my emotional state? Usually, depending on how you slept, it's going to affect your emotional state. Right. So, and what am I telling myself about this? It always goes back to that, right? So that's, that self-awareness, that yoga practice. It's not about, oh, I feel terrible and I'm stressed out and I don't think I'm going to make it through the day because I'm exhausted.
Right.
It's like, wow, I didn't sleep well last night. And so what am I telling myself about this? Then there lies another opportunity. There's always an opportunity to get that shift in your mental
State of mind.
State of mind, exactly.
Yeah.
So I'm checking in with my energy level, and then I'll start with some gentle movements. And especially because I'm aging, but my body's been injured. And so I might start just moving my toes and my fingers and my ankles and knees, and then maybe even doing like a spinal twist in the morning, get my spine moving.
Well, this is great, and it's reassuring because according to many of the videos on Instagram that I see, I would have thought maybe you would have said I jump into a handstand and then do it backwards walkovers.
I sleep in a handstand typically.
So I'm actually, this is good because it's a little bit more forgiving, because I see this and I think, I'm never going to wake up and go into a handstand or forearm stand or anything of the sort. So, I love that because once again, it meets you wherever you are.
Exactly.
You check in on your breath. How did I sleep? How do I feel? What's informing me in my psyche, my emotional base, and my physical state? And how do I address that right now?
Yeah, the beginning of self-regulation, waking up in the morning,
That's so
and
beautiful.
it's so empowering.
Yeah, I get it.
Yeah, it's
you're
very
really like tempting me to start yoga here.
Well, I hope so.
Yeah, and this is really funny because my past. I started out with powerlifting, Olympic lifting, martial arts, running, and so forth. So I was always, it had to be movement, and fast movement, right? So my father assured me, he said, son, one of these days you'll give up all that heavy weightlifting, and there will come a time where you're going to have to find peace with lighter weight and doing things that are less resistant in nature.
Yeah,
and,
smart
I'm wondering,
man.
Yes, he was a very smart man. And, it's interesting because you talk about doing yoga and how it can increase flexibility of one's life. And it's funny how right our parents are sometimes. My dad has been gone now, sadly, for going on 12 years this July, and he gets more right as time goes on. He assured me that one day I would have a more gentle approach to life and to living, and I'm not happy necessarily yet. I haven't made the transition. I still occasionally like to grab a set of heavy dumbbells and throw them around and, sort of my equivalent of beating my hands on my chest and saying, yes, I'm all that still. But I do see the light at the end of the tunnel, meaning my body isn't as forgiving anymore.
Right.
My mind and my ego like the lifting of the heavy weight, but my body not so much anymore. So you have me very interested in looking more carefully at yoga. And I mean more globally. I don't know that with the severity of my injuries, I, like you, I've broken my back and did so during an ice storm and so suffered from 4 to 6 fractures that changed my life forever. And informed me of its nastiness to this day, over 30 years later. And so I was always very intimidated, as are many of the people I speak to in my practice. When I suggest yoga, they all have this, I can't do that. I see the pictures on Facebook and Instagram. I can't even think about that. That's too intimidating. And so I love that you have such a wise perspective. The idea that you can start by altering your breath or by the focus of your mind.
Right. There's a saying, a little bit of something is better than a whole lot of nothing.
Yeah, and there's a lot of truth to
starting
that.
somewhere.
Starting somewhere, sure. So tell us more. How else does yoga show up in your life?
Yoga shows up in my life in how I engage with people. I think it's made me more compassionate.
Right.
Again, I love the ability in my life now to see people where they are, but know their potential so much greater, and to be able to inspire and instill in them, hey, I was there. I was several months after my car accident learning how to walk again in a pool with a treadmill. I was walking with 2 hiking poles because after 15 minutes of walking, my left leg would give out and I just couldn't walk anymore. And from being able to run and to cycle, and my doctors told me you should get rid of your sports equipment and then you'll feel better, because as long as your bicycle's in your garage, you're going to be sad. And
how disheartening.
It is disheartening, but now I'm cycling and I don't run as much as I used to, but all of these practices, and I mean step by step, just the little steps. You don't have to go into an hour class. You just have to take a moment to say, what do I need? What can I improve today?
Well, once again, I love your approach, because there are days where I'm in a lot of pain and I do a lot of physical work with my patients, and I might go for 20 minutes. And, 10, 15, 20 years ago, that was laughable. Mm-hmm. It was like, are you kidding me? I'm just begin my warm-up for 20 minutes. And now I go in, and what I do is significant. I mean, I'm not standing around chatting, but I get in 20 solid minutes, and I find peace with it, and it makes a difference in the quality of my life. Mm-hmm. So let's go off.
It's about quality, not quantity.
Yes, and that is becoming more and more apparent, isn't it? Quality of life. Dr. Grace, let's talk about how you might use yoga for people who are suffering from chronic degenerative diseases, whether it be autoimmunity or cancer. I know you do a lot of work with people who are disabled.
Yes, I've worked with people with multiple sclerosis, ALS, cerebral palsy. I've worked with people quadriplegia, paraplegia.
Wow.
You can find a practice at any of those limbs to improve your quality of life.
Right.
And again, it goes back to, you will always tell yourself a story. And you have the option to tell yourself a healing story or not a healing story. And once someone makes that decision that I'm not going to be a victim, whether it's, even if it's something you're going to die from, we're all going to die from something.
Yes, we are.
You could still have a quality of life. I was working with several people who thought their body couldn't do certain things. And maybe the doctor told them, well, your chronic illness is getting worse. Whatever it is, right? They've lost something. And it's amazing when they realize they do have more control of their bodies than they think. The gains that they make, they're walking better. They have improved balance.
Right.
I've worked with people, one gentleman, I call him my student of a lifetime. He's passed away, but he had a quality of life. He was quadriplegic. He was in a bicycle accident. And his family thanked me at his funeral. They said he transferred better out of the wheelchair. He was breathing better. He knew how to lift himself up.
Yeah.
He knew how to use his mind, right? And that's part of yoga. It's like you can allow your thoughts to control you.
Right.
Or you can control your thoughts and have an incredible quality of life regardless of the circumstances.
Sure.
And so that's what I found, working with people with MS or CP or any kind of injury, non-ambulatory. I've even worked with people in hospice, and you think, wow, that's a scary time. Or I've had family members call me and say, can you go in and see my mother or whatever, because it's so hard for the family. And I used to think, oh my gosh, how can people do hospice? That's, those are just
Sure.
people that are angels. But when you realize it's the process of life that we do have so much control of, the internal, and to be able to guide someone through that
It makes a lot of sense.
is a huge gift.
Sure.
Again, back to the fact that I'm so humbled to be a teacher, but to be able to teach people these skills, you have more going for you in your last breath than you can ever imagine. And maybe that's the most quality moment that you have, depending on the thoughts that you have when you leave this earth.
How absolutely wonderful. You allow them grace and dignity, and to have some attitude and some vehicle for changing perhaps the way they transition from this form into the next. That's really, really beautiful.
Thank you.
Yeah, you're welcome.
It's a gift, and it definitely keeps me humble. And again, when it came to that point where I felt like I was a victim and I changed my thoughts to how can I serve, I realized that there's so much beauty in this world. There's so much more than us. And when we're in pain and we're ultimately suffering for whatever reason,
Right.
we isolate ourselves. And through yoga, whether it's group classes or how you're just feeling about your fellow man, you can really change things for the positive and have a better quality of life, regardless of circumstances.
I just keep loving this more and more. I may become a yoga master. Anytime. Fantastic. Tell us more about how you, what would you do to start somebody who's severely disabled? That's another fascinating topic. What does that look like?
What it looks like is having a conversation, and one of my favorite teachers, he said, before you start this work, and we call it sacred work.
And that it is.
Before you begin this sacred work, check yourself. Why are you trying to help someone? Right? Am I trying to help someone for my ego or my own purposes, or am I really trying to help my fellow man? Right? And when you come from that point of, I want to help my fellow man, you are able to sit side by side, shoulder to shoulder with them, and be in the presence of suffering without trying to fix it. So the first thing, whether they're disabled or they have a chronic illness, they're not broken. I don't need to fix them. And they need to know that.
Yeah, very, very important, because I'm sure that's how many of them feel.
That's
I'm
how they
broken,
feel.
And I have no hope, and
Yes.
there is no hope for me to have a better life.
Exactly. And I felt that way too.
I did as well.
Right? So that's where you communicate, and you start just at that, hey, I'm not trying to fix you because you're not broken.
You're
But
meeting
let's
them
talk about meeting them where they're at.
where they're at.
Yeah.
Gosh, I love that. That is so important.
And just starting that relationship and finding out what's most important to them and maybe working towards those goals first, or maybe starting them with gentle movement, or maybe I incorporate the Thai yoga massage first and, wow, I didn't realize my hips could move, or I didn't think I was that flexible. And they start to learn through the movement that their body really can do more than they think. Typically, that's the case, and again, maybe it's not movement. Maybe it's health through a better state of mind. Maybe it's health through breathing.
Yeah. Where, in other words, once again, meeting them wherever
Meeting them where they're at.
So I have a question for you, and you may say that's a silly question, Nelson. It's so obvious, of course. It occurs particularly now that we're engaged in the Me Too movement that there is a theme of disrespect and marginalization of women. So yoga seems like such a perfect fit for being able to take somebody who might, from a cultural perspective, feel like they have been invalidated or marginalized, and allow them to once again be met exactly where they are without condition. Do you see this often?
Yeah, I've worked with many women who had been sexually assaulted or sexually abused, and again, it's that going within is scary for them.
I imagine it's terrifying.
The internal atmosphere is terrifying for them. And being able to maybe start with that one point of focus, start external first. Yeah. Maybe it's the movement. But as they start to move and as they start to breathe better and they get stronger physically. Right. And they get stronger physically, the self-esteem increases.
Sure. They become more powerful inside and outside.
Yes, that they're making changes, no matter how small, they're making changes in their body, in their mind, that is helping them live a better life, a life of less fear. So, for instance, if they have anxiety attacks in the middle of the night, there's different ways of breathing. This is how you're going to handle it. Let's just try not just one, but 2 or 3 techniques and practice them and try them at different points. What works for you at work? What works when you're in the car? What works when you're in a situation where you're in public? How do you handle these things when you're having, a panic attack or whatever it is? Being comfortable in your own body, having that, what we said earlier about the self-mastery, learning that self-regulation. This is what's coming up for me. This is how I'm breathing. This is what I'm telling myself about what I'm feeling in my body right now. And being able to pause, put the pause button, right? So the teacher I was talking about earlier who taught me how to work with people with various abilities, he said, everything can be a transition. Right? So just because if you're in this room and you're in panic doesn't mean you have to take the panic outside the room.
Wonderful.
There's a transition. So take a breath. Every time you wash your hands, that could be a transition. Take a moment to breathe. Feel your feet. Usually we get so in our heads, all the energy is like everything rises, energy rises. You boil water, you're going to see the steam rise, right? So as all these thoughts and emotions are coming up during the day or in certain moments or triggers, and people who have PTSD always have a trigger. Okay, here's my transition. It just came up. Let me take a breath. Just because I'm feeling this right now doesn't mean I have to feel like this all day. We become fearful of the fear. We get fearful of the panic, and it becomes a spiral that you can't get out of.
So not only are you teaching them how to be met wherever they are, but you're teaching them through process and structure how to flow from one state. So if there is a disagreeable state, a panic, for example, that they can transition with some flow and gain finesse in being able to go to another state that is perhaps more self-serving.
Yes, honoring the transitions.
Beautiful.
Just noticing them and honoring those transitions. You get up and you're in a bad mood, honor the transition. You don't have to be like that in the car. Or you get out of the car, you take a deep breath, put your feet on the ground before you start work. I feel my feet, I'm grounded. I feel the top of my head, I'm lifted. Always creating balance, and that's also part of yoga and qigong. Something has to go down, something has to come up.
Right. Wonderful. All right. Dr. Grace, thank you. We're going to take a quick break. We'll be right back. You're listening to Health Matters. Our guest is Dr. Grace Stephen. So,
Hi, I'm Greta Foll,
anything you
president
wanna
of Golden Home
mention?
Services. We all have
I'm gonna ask you
parents,
for
and I know
summary.
I love my parents more than anything else in this world.
Okay.
And because of that, Golden Home Services makes sure we care for your parents as if they were our parents.
Welcome back. Once again, you're listening to Health Matters, 99.1 FM. We have Dr. Grace Stephen as our guest today. She has been a wealth of knowledge about yoga and what it affords us to live a better life. Tell us, we've got several minutes left. Let's talk about where are you now and where do you want to be in the next years? You're such a wonderful speaker and your knowledge base is wonderful. I'm sure our guests have absolutely loved hearing you speak today. Where do you want to be in the next 5 years? Where are you headed?
I want to spread the word more. That's why I'm very grateful to have this opportunity on your show. So thank you very much. There's so many things that are going on in this world and in life right now. And people are really struggling. Again, kids are scared to go to school. People have so many health concerns. And I've been there. I've been there. I've had panic attacks. I've had a body that didn't work. I had to mourn a life that I had. And I've come to, through these practices, through yoga, through qigong, all the mind-body practice, through meditation, found so much peace and such a quality of life that I really want to spread the word. So if I had the opportunity to go out and speak to bigger crowds or speak to schools, or police departments or wherever, this word is needed, whether it's teaching them one technique or just talking about yoga, to educate people. These practices have been here for thousands of years for a reason.
How wonderful. A friend of mine said that, Nelson, we get hooked on one perspective, whether it be a political ideology, whether it be a religious ideology. He said the truth is anything that has been around for 500 or more years has to have some element of truth to the body, to the body of information. So is there a particular group of people that I know you love working with athletes. I know you have a pretty diverse palette. You work with a lot of people, men, women, athletes, the elderly, the young. Is there a particular group that maybe you haven't worked with yet, or a group that you want to pursue greater efforts in the future?
I'm not sure if it's a particular group. At one point I thought I needed a business coach. He said, you need a niche. You need that niche. And basically, you have to focus on something because you can't tell them that you're working with, people from the womb to the tomb kind of thing.
Yes.
But I couldn't do it. And I couldn't do it because it's the human condition.
Right.
And it starts when we're young.
Yeah.
And it starts when, baby's crying and they're not being cared for. And, that affects them as a toddler. And then the toddler becomes, maybe an ornery teenager, wherever it is. It's all the same problems. It's all the same. People want the same things. They want to be noticed. They want to be cared for. They want to be loved. They want to feel part of something. They want to move better, breathe better. And so I just can't say there's that particular. I think wherever I am led, wherever I can best serve, I will be there. I'll stand up and I'll rise to the occasion.
Yeah, that makes a lot of sense. Wonderful. Very, 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 very good. What last words would you share? We've got about 5 minutes. What would you share? Let's talk about women first because that was our initial focus.
Sure.
So you teach yoga to anybody, but we're focusing on women. How would you summarize today's interview? How would you give hope to the women out there who are listening? What would you say to them?
I would go back to that quote I said earlier about yoga doesn't take time, it gives time. And I know that there are women, but you don't understand. I've got 2 kids or 3 kids, and we have they're running around to soccer and football and baseball. Yoga, any part of that practice doesn't have to be an hour. It doesn't even have to be at a studio, right? Maybe your yoga for the day is reading something out of a yoga book, 1 paragraph.
Right.
Maybe your yoga for the day is when you wake up in the morning and you're starting your day the way I start my day, just listening, right? Just listening. What's going on? How am I feeling? it can be honoring your transitions, taking a breath from dropping your kid off at school to picking them up and bringing them to soccer practice. No matter what you do, you can incorporate any part of yoga in your life. So whatever interests that person, again, talking about self-awareness, what is it I need right now? Do I need to quiet my mind? Do I need to start moving? Kind of figure out where you're at first. And then take one approach, one step. And there's so many avenues, there's DVDs, there's books. You can go onto the Yoga Alliance website and find practitioners in your area. You can find yoga therapists. You can even ask your friends that are going to yoga class, what kind of benefits are you getting? What type of yoga are you doing? And then try several different classes. Many times people will go to a particular yoga studio and say, oh, there's 20-year-olds in, Lululemon pants, and that's just not for me, right? So
that's why I don't go, Grace.
Yeah, but you look great.
Thank you.
Just taking multiple approaches, not giving up because you went to the wrong studio for your age, for your look, or whatever you're thinking, whatever you're telling yourself, whatever that story is. And meeting yourself where you're at, and yoga will be there. And, some of your best resources are your friends. I have a lot of doctors that refer to me, medical doctors, neurologists, nurses. Sometimes your healthcare providers, they practice yoga, or they might know someone to refer you to. So again, reaching out a little bit and finding out what you need, what you want to start with. You don't have to do it all. You don't even have to give an hour of your time.
Right. So what I'm hearing is you just have to begin somewhere. And
yes.
Yoga will meet you wherever that is.
That's true. Yes.
Wonderful. All right. So listen, it has been such a privilege to have you today. And I'm going to invite you for further shows.
I would love that. Thank you very much.
You are very, very welcome. Before I let the audience go, I want you to know in 2 weeks, I'll be back. I'll have another esteemed guest. It will be Dr. Bill Lawrence. He will tell us the amazing story of Russian peptides, known as bioregulators, and how by taking certain bioregulators, the Russians have proved over the decades that telomere length can be lengthened. And for some of us, more and more of us are realizing that as of 2009, when Elizabeth Blackburn and company won their Nobel Prizes in medicine for understanding in part that the relationship is that as telomeres shorten, our ability to have our cells divide lessens. And the secret is out. When this happened, the Russians let the cat out of the bag, so to speak, that we can now use bioregulators to lengthen our telomeres, which means that provided we don't die of an accident or an illness like cancer, that we now have the tools to increase life expectancy. I'll look forward to being with all of you at 5 o'clock 2 weeks from now. Thank you again for joining me. I'm Dr. Nelson Bulmash, and you've been listening to Health Matters.
Thank you for joining us on this edition of Health Matters with Dr. Nelson Bulmash, where we help you discover how to ignite your mind, body, and spirit connection.